a seropositive husband and a seronegative woman chasing reproductive successes. With a very successful antiretroviral treatment, the HIV positivity itself is very low, and most of the couples are very keen to try for the reproductive successes. So, this is a nice paper by Joseph Fourie et al., which was published in Fertility Sterility on semen decontamination for the elimination of seminal HIV-1. Multi-drug high-active retroviral therapy has greatly improved survival of HIV-positive males. Shedding of HIV in semen occurs due to co-infections like prostatitis, urethritis or cystitis, or poor adherence to antiretroviral therapy in spite of very low detectable plasma viral load. 6.6% of men had their semen positive for HIV-1. In the exclusion criteria, the men with CD4 count of less than 300 cells per microdeciliter, they were not selected since they needed a very intensive antiretroviral therapy and they were referred for the same. They totally took about 4 semen samples a week apart. 2 samples were screened for semen parameters, while the rest 2 were used for therapy. And viral validation of the final processed semen was done by PCR DNA1. So, the 2 samples underwent a complete viral validation, etc., and the same methodology was used for other 2 samples which were then used for therapy. And what they found? They found 98.1% decontamination was successful. So, it was not 100%, and this was used for IUI. So, if you want to do for an ICSI, probably you are just selecting one sperm where 100% could be possible, but for an IUI, it is merely risk reduction. So, seminal HIV, cell-free DNA, proviral DNA or CD4 receptor carrying lymphocytes could be there, and they would still offer HIV positivity after the washing is complete. So, patients herein must be counseled that semen decontamination is merely a risk reduction exercise. False, and sometimes it could be even a false negative PCR or an inconclusive PCR report is positive, and then HIV decontamination may not be to its completeness. And this vital transparent information must be shared. Most important, before advising an HIV positive sample to undergo an IUI cycle, you must validate that the final product after semen washing what you are having is PCR negative earlier, and then only use the same method